Okay, so welcome everyone to Remote Nursing Jobs. My name is Sarah and I'm a registered nurse. So thank you so much for joining. I know that this is of interest to a lot of you, and I wanted to talk a little bit about how you can get a remote job, what kinds of experience employers are looking for, advice on how to word your resume and your cover letter, and then also just some tips and tricks from myself because I've been working a remote nursing job for the past 2 years since the pandemic started. So just a little bit about me. I've been a nurse now for 15 years. I graduated from Western University in London, Ontario, Canada. I also have a Master's of Nursing from the University of Toronto. And like I said, I've been a nurse for 15 years. I started out as a bedside nurse. So I've worked as a postpartum and NICU level 3 bedside nurse. I've also worked in a gynecology clinic. I've worked as a prenatal educator. I did a year of research. I've done, what else? Continuing education for college level. And then after I went on my first maternity leave, I decided I wanted more, 9 to 5 hours. So I've also worked as a clinical nurse specialist in obstetrics. I've worked as a professional practice specialist. Currently, I work in home care, and many of you might know me from my podcasting life. So I'm the co-host and co-founder of the Gritty Nurse podcast, and I'm also the CEO of the thernresume, where I help a lot of my clients with things like resumes, cover letters, LinkedIn profiles, general interview prep, and career coaching. And so that's kind of me in a nutshell. And I've been doing some of this work with advocacy and helping nurses with their careers over the past couple years. And hopefully some of the learnings I can share with you can help you as well. So this is a little bit more about me. So I'm going to actually start a poll. I just want to know a little bit about you guys today. So I'm going to actually launch the poll. If you could just take a few minutes to let me know where you're calling from today, what your current position is. So whether you're clinical or in leadership, research, student, or other. And really, when you think down to it, what interests you most about remote nursing? So I know obviously there are a lot of things that interest a lot of people, and everyone's feeling burnt out these days and looking for a change. So I just wanted to know what made you want to sign up for this webinar, and what really interests you most about moving into a work from home or remote position? Okay, so I can see that a lot of you are responding. So lots of people from Canada, a little bit from the US and other. If you could let me know in the chat, if you're calling from another region other than Canada or the US, I'd love to know where you're calling from. And I can see that lots of folks in clinical roles right now, which is great. A couple in leadership and some students. And then we've got some people in the other section. If you are other, I'd love to know what your current position is. Maybe you're looking to get into nursing, or if there's some other industry you're coming from, I'd love to know where you're coming from. Okay. So it looks like the top reason for your interest in remote nursing jobs is work-life balance, and that's followed by flexible schedule, using or learning new skills, better hours, and pay. Awesome. All right. So I'm just admitting a few more people into the webinar. If you've just joined, we're just polling everybody on where you're from, what type of clinical experience you have, or maybe you're in leadership or another role, and also what interests you most about remote nursing. Okay. So let's give it another maybe 20 seconds. I'm going to end the poll, and then I'm not sure if you'll be able to see the results, but I'll end the poll in just a minute and share results. Okay, I'm ending the poll now, and I will share the results with everyone just in case you're curious. So it looks like most folks are from Canada. Most of you are either in a clinical role or other, and a lot of you are interested in work-life balance and flexible schedule. That's awesome. Okay. All right, so I'm just going to continue on, and guys, feel free to put your questions or comments in the chat. I'm just going to go through the slides, and when I get to the end, I will open it up for questions, or if you wanted to unmute yourself and ask me something as well, that's totally fine. Okay, so just wanted to dive right into it and talk about job searching in terms of remote nursing jobs. What kinds of things you want to look for. So first of all, the remote nursing term, I think is the best term to use, although it can be a little bit confusing. So even when I was promoting this webinar, I did get a couple questions about whether I was talking about remote as in work from home, or if I was talking about remote as in a rural location for nursing. So when you're doing your job search, you want to use a variety of different keywords. The first one being remote, you might want to try also virtual, hybrid, work from home. These are all really good keywords to use. In some examples of remote jobs, I'm going to go over a bigger list in a minute, but some examples might be coordination, case manager, online instructor, remote patient monitoring nurse. Like there's tons of jobs right now. And I think even thinking back to 5 years ago, the types of jobs available now for nurses that allow you to work from home is growing by the year. So definitely, I will give you some concrete examples of what you can use, but it's not limited to what I'm telling you either. So I think it really is just broadening your search, using your networking, and seeing what the trends are. Another place you might want to start is looking at remote job boards. So for those of you that are calling in from the US, there is a great nurse that I recommend following, Remote Nursing Jobs by someone named Sadie. So she has a lot of remote jobs that she posts. I will be starting a newsletter shortly with remote jobs for nurses in Canada. So at the end of the webinar, if you want to sign up for my newsletter, I'm going to be starting a weekly Canadian virtual or remote job posting board that you can sign up for. Okay. So just moving on to the next slide. I know this is really busy, but I wanted to give you some examples of remote jobs. And because I'm a little bit OCD, this is in alphabetical order. So starting with the first one, care coordinator is an example of a remote job. You might also want to look at something involving case management, clinical documentation improvement. So when you think about documentation in general, everything's moving to electronic. So a lot of this requires a lot of upkeep and implementing new types of documentation and improving what's available. So that's a big one. You might also want to look at clinical review and auditing. Another example would be coding or data abstraction nurse. You could even be an educational sales consultant where you do virtual types of calls, or being a freelance nurse writer. A lot of times now I'm seeing a nurse coach or health coaching. So where you're coaching other fellow nurses on how to prevent burnout. And if you're looking at sales, if you've ever been interested in sales, working for a medical supply company as a medical sales and product educator, or even a nurse consultant or nurse liaison, nursing informatics is also really big right now. If you're looking to stay in the hospital system, that's something that every hospital needs. You can look at being an online instructor. So whether it be for teaching other nursing students or teaching things like online CPR, that's another great option. You could look at quality improvement and risk management. So most organizations actually have a department for quality improvement. So definitely something you can look into if you've got a few more years of nursing experience under your belt. Remote patient monitoring. So this is a big one as well. There are lots of initiatives now to keep patients out of the hospital, doing something called remote monitoring if they're fairly stable. So that's another, I think, job that is becoming more popular. And telehealth. So for those of you in Ontario, you know about telehealth. So calling over the phone and speaking to a nurse, and he or she can help you figure out what your next steps are. Telephone triage. So that's kind of similar to telehealth, but it can apply to a variety of different settings, and something that if you're really good on the phone or you're good at patient education, this might be something that's up your alley. Something else called utilization management is also an up and coming position, as well as virtual care. So for those of you who have used virtual care yourself, you know that this is something that a lot of primary care providers are moving towards. Even in the community, virtual care has become a lot more popular. So being a virtual care nurse might be something of interest to you. And I indicated that you could be an online instructor, but I wanted to highlight also being a virtual CPR instructor. So most hospitals do require their employees to go through CPR every couple of years, and CPR is actually offered remotely if you haven't had to do it yet. So this might be something that you're interested in as well, either in addition to your current position or something that you do for more hours. And last but not least is workplace insurance claims. So this is something that a lot of nurses have been doing even prior to the pandemic. So working for something like at WSIB full-time is definitely an option if you're looking for more of that work-life balance. Okay. So now that we've talked about some examples of remote work and where you can look for it, now you really need to think about what your needs are. So I know it's really easy to think that the grass is greener on the other side, but when you're looking for a remote position, you also need to think about what your personal needs are. So the first thing that I would want you to ask yourself is, or ask the employer, is it fully remote? So is there any expectation that you spend a certain percent of your time in the office or face to face? Is this something that's remote for the time being, but the long-term plan is for you to actually have to travel to work? So that's the first thing that I would ask, and I would look in the job description if you see anything about hybrid or what the actual expectations are for being remote. And are you okay with something being either fully remote or partially remote? The next question you want to ask is, are the hours flexible? So I think there's this perception that if you haven't worked a remote job yet, that you can kind of do the work whenever you want and that it doesn't really matter what your hours are. But I can tell you from experience that just because something is remote doesn't mean that you have complete control over your hours. So there may be a number of meetings that you still have to attend, whether it's virtual, you're still going to have deadlines that you have to meet, and you will need to be able to manage your time effectively without someone kind of standing over your shoulder. So asking if the hours are flexible and also looking into the requirements of the physical location. So I think there's also this perception that if you take a remote job that you can work from anywhere. And it really depends on your employer, but there are some employers that have a requirement on your physical location. So you might need to be within the same state or province that you're employed at. And for some jobs, you may be able to travel around. I know there's lots of nurses that do the whole, they're living in an RV and they're working. So it just depends on if there are any stipulations as to where your physical location has to be. And I know for some organizations, it's because of PHI. So because of confidential information and the servers and where that's physically located, it might require you to be in a certain area. And another thing you'd want to ask is, or just even try to figure out for yourself is the organization innovative? And what I mean by that is, are you going to be one of the only people that's working remote and everyone else is in person? Or is this an organization that's kind of trying to be more remote in general? And that way you kind of have your team, everyone's remote, and you're kind of all on the same level. And in terms of even technology, are they going to be able to support what you need in order to work remotely effectively? So these are all things that you want to think of when you are looking for a remote job. And I want to tell everyone just to beware of scams, because this is something that can come up. A lot of organizations, a lot of scammers know that nurses are looking for remote work. And so really, I want you to do your homework before you have an interview, or even especially before you accept a position. So research the organization and the recruiter profile. So if you have been in contact with somebody, I think it would be really easy just to Google their name, make sure that either the person you've reached out to or the company that you're interested in isn't affiliated with any sort of online scam. You could even check with the HR department if they employ a recruiter by the name of whoever has reached out to you, and really just Google online scams. And I think the best thing to do is go to a website called Glassdoor, which a lot of times has reviews from either current or past employees, and you can see in general, is this a place that you want to work? Have there been scams in the past? Is there high turnover? So I just want to caution people as well that with Glassdoor reviews, it doesn't really give you the full picture. So you're going to get a lot of people that really didn't like it or really liked where they work. But it does give you an idea of the general work culture of the place that you might be thinking of working at. Okay. So the next thing I wanted to go over, because I am a resume writer, I wanted to go over ways that you can make your resume pop. So in terms of soft skills and hard skills, the things that you really want to look at, especially if you haven't been in remote nursing before, is focusing on some of those soft skills that are transferable from the bedside to the office place or your work from home office. So things like being a proactive communicator are really important. Having good verbal written communication skills, because you're not going to have as much face-to-face communication anymore. A lot of it is going to be written. So make sure that you highlight that as a skill that you have. Also, the ability to work with minimal supervision, because as I said, you're not going to have anyone standing over your shoulder. A lot of times you might not have very many one-on-one interactions with people outside of meetings. So just really highlighting that you can work with minimal supervision, that you've got good time management skills. And a huge one to highlight is your computer literacy. So any sort of electronic or EMR documentation systems that you have experience with, you can list all of those. Any sort of experience you have with Microsoft Office. So we're talking about Microsoft Word, PowerPoint, Excel, Outlook. So all of those systems are really in demand by hospitals, not so much anything from Apple, unfortunately. So really highlight anything that's Microsoft based. You can even talk about skills that you have in terms of meeting platforms. So Microsoft Teams, Zoom, Google. So Google products such as Google Drive or Google Docs. If you're applying for sort of a project management position, you might even want to highlight chat tools that you've used before, such as Gchat, Slack. There are project management programs called Trello or Basecamp. So anything that you feel can make you stand out that you actually have experience with, I would list on the resume, and always make sure that you tailor your resume to the type of job you're applying to. The other thing is that you want to look at the keywords in the job posting and try to use them as much as possible, either in your resume or your cover letter. So when you apply to a position, usually it's on a website. So unless you're actually emailing it directly to a person, if you're uploading it to any type of website, you want to make sure that your resume passes the applicant tracking system. And the best way for you to do that is make sure that you match the keywords. So try to do that as much as possible. And for example, a keyword might be electronic documentation system. So you want to use phrases like EMR, H or EHR, which stands for electronic medical records or electronic health records, and even putting that acronym in brackets, because that will help you match it more than once. The other thing is, I am a really, really big fan of LinkedIn. So if you don't have a LinkedIn profile, I would suggest that you create one, or if you have one that you don't use very often, make sure you update it with these same keywords and same skills. And using LinkedIn, you can look for different remote nursing positions by location or by type of skills. Or if you do your LinkedIn profile correctly, you can even have recruiters reach out to you, which eliminates a lot of the time and effort on your part. And just talking in general about why your resume is so important, aside from actually listing your experience, it tells the employer that you can do a few things. So the first thing is that it shows that you have great or strong writing skills just by the way it's written, making sure the layout is consistent, that you don't have any spelling errors. It also shows your attention to detail, because a great resume can show that in itself. It shows that you can work with Microsoft Word or whatever word processing system you decide to use, and the ability to be concise. So one of the things I tell all my clients when I'm working on the resume is that less is more. And really the goal of your resume is to get you the interview. It's not to list every single thing you've done. And like it or not, people read a book by its cover. So you really have to make your resume stand out in different ways in order for you to, get that interview or even get that job offer. So some of the things I just wanted to go over with you in terms of your cover letter. Oh. So I guess I forgot a slide on cover letters, but cover letters, what I wanted to say about cover letters is that this is optional, of course. You don't have to have a cover letter. And it's this thing that people talk about. Should you have one? Should you not have one? Do people read cover letters? Do they not read cover letters? I think that if you have the time, it's always helpful to have a cover letter and put it in the same document as your resume. Because let's say you can't fit everything you want to say in your resume, or you have more that you want to share. The cover letter is a great place to highlight a little bit more or share more of your story. And again, it's a way for you to include more of those keywords if they didn't really fit in your resume, or if you have a really compelling story that you want to share. This is the perfect place to do so. Just make sure that your resume is no more than 2 pages and your cover letter is no more than 1 page. So that's something I would always suggest. Okay, so now just talking about skills, because I think a lot of you might be thinking you want to go into remote work or remote nursing, but you may not have all of the skills that they're looking for. So one thing that I would suggest is signing up for LinkedIn Learning. And for those of you that are in Ontario, if you do sign up for my newsletter, I can give you a link to a site for free LinkedIn Learning until the end of March of this year. Or you can, of course, sign up on your own. I think there are a lot of great courses that you can sign up for. They usually give you a certificate at the end. So if there are certain programs that you want to brush up on or just add to your resume, I think LinkedIn Learning is a great place to start. You might also want to look into remote volunteer experience if this is an area that you want to beef up a little bit. So let's say you are thinking of volunteering anyway, maybe looking for a remote volunteer opportunity would be a good way to get some remote experience as well and learn and brush up on those types of skills. And if there are certain software certifications that you don't have any experience in, you can just look up if there's a certification course that you can take. I think that these skills are easy to learn. It's the clinical skills that you have as a nurse that are so valuable, and these are just additional skills that you can add to your toolbox. Also, don't discount your local public library. They often have a lot of great online resources. So I know that when I used to live in Toronto and I was part of the Toronto Public Library, there's actually a way to get free access to LinkedIn Learning, which I didn't even know I could do. So you're saving lots of money as well, because all of the resources at your local library are free, and you just need to, sometimes it's just a matter of knowing that they're available for you to take advantage of that. Okay. Okay, so I did have a section on cover letters. So in addition to what I had mentioned about cover letters already, what you do want to do in a cover letter is not repeat everything in your resume, but you do want to add a little bit more. So in terms of why you're a good fit, really think about what they are looking for in the ideal candidate and what you can offer. You also want to talk about why you reached out. And here is where I would do a little bit of research on the organization's mission and values, which you can easily find on their website. But don't say it's just because you want to work from home or that you want better hours. I think that's pretty much a given, but they want to know what it is that you can do for them. And then think about all of the transferable skills and abilities you have as a nurse. So, bedside nurses have really great ability to work well under pressure. You can prioritize tasks, you can multitask. You've got great, interpersonal skills. So these are all things that I think you should highlight and even give specific examples when you can as to how you have these transferable skills or you have these abilities that are going to set you apart from the other applicants. Okay, so now let's talk about interview prep. If you haven't been to a virtual interview before, I think, or even if you have, this is really a good time to prep yourself because as I mentioned, going into remote work, you really want to show that you have those computer skills. And part of that is being able to log in seamlessly to a Zoom meeting or a Microsoft Teams meeting. So I think the first thing that everybody should do prior to an interview is a tech check. So check your computer, make sure that you're able to click on Zoom and that you can log on without any problems. If you need to upgrade your browser, make sure you do that. If your computer is slow, make sure you figure that out. Make sure your computer is plugged in. I think these general steps are just going to reduce your anxiety on the day of the interview. The other thing is that you want to do a check on your lighting. And so make sure that you've got a good source of light on your face so people can see your facial expressions. Make sure that your speakers are working. Make sure that there isn't any background noise that's going to distract from the interview. And make sure that your actual background itself looks professional. So if that means that you need to apply a filter on your background, figure out how to do that before the interview starts. And in terms of appearance, I always say from the waist up, dress as though you are attending an actual in-person interview. So whatever you need to do to look professional and feel confident, do that from the waist up. And if you want to wear nice dress pants as well, I think it's just about making sure you are in that right mindset and you have the confidence you need to have a good interview. And another great thing about being virtual is that usually you're sitting in front of a screen and maybe you're even in front of a wall. So use that opportunity to write sticky notes and stick them around your screen. So if there are any talking points that you want to go over so that you don't forget, you can definitely take advantage of that. And that's something that you can do virtually, but you can't really do in person. So just something else to think about when you are going for your interview. If you have been given the names of people you're interviewing with, do a little bit of research on them too. So when it comes time for you to ask any questions, you have questions to ask that show that you've done research and you're really interested in the role and the company. And next steps. So if you are serious about looking for a remote nursing job, I would start looking at job postings and applying. And you can sign up for the RN Resume newsletter just by going to my website, the rnresume, all one word.com. You can send me a message or DM if you want individual help. And my email is listed below. I actually realized I made a typo. It's the rnresume, all one word, @gmail.com. You can also follow me on my socials. I'm on Facebook, Instagram, and LinkedIn. So just wanted to end by saying thank you to everyone. If you're looking from going from this nurse on the left, who is feeling somewhat stressed and burnt out, to a remote work from home worker